Hello, Dr.Day and I here from Steinway Family Dental Center. We get a lot of questions from you guys about dental financing and if it's available for you and so on. So today we're going to answer some of the most common questions that we got from you. And the first question is, if I need some dental procedure but don't have the money to do it, is the financing option available? And the answer is yes, it is available. It depends on your credit score, of course, because most of the time it is from the bank, and the bankers would want to know that. Depends on the amount of money you need and amount of time you want to pay it back. If it is something that we can do in like maybe 2 payments, we can do it right here in the office and we don't have to ask any banks for it. But if it's something that you need a long time, let's say you would like something for 2-3 years, then that of course comes from the bank. The next question is, will I have to pay for my dental procedures up front? Well, different arrangements are made, but of course it is best if we first deal with the financial aspect of it and then just worry about the treatment and not go back to the financial aspect. Because it does feel sometimes that, for example, I have this patient who started Invisalign, and then when it came to get retainers, the patient says that cannot afford retainers. So we just wasted all this money and time treating Invisalign, and now we cannot retain the teeth in this position, right? So I would rather know that ahead of time. So everything should be known. This is the bill, this is how much it's going to be, and this is what we have to do. So everything is covered and we don't have to go back to speak about the payments anymore. The next question is, what dental financing options are available and how do they work? One of the options is you pay as you go, right? Like let's say the procedure is $10 and you want to pay 5 on the start and 5 on the finish. It takes, let's say, 2 visits. So the first visit you pay $5 and the next visit you pay another 5 and you're done. However, if the payment is more than $10 total, right? Of course, I'm exaggerating things. And let's say it's $12 and you want to pay over a period of 1 year. There are plans available that are interest-free for up to 2 years. So your payment might be, if it is $12, $1 a month, right? Of course, those are not the numbers. You know, the numbers we're operating with, they're a lot higher than that. But also, if let's say you cannot afford to pay $1 a month, and you want something smaller than that, so you can do 50 cents a month for 2 years, and it's also interest-free if your credit score permit the bank to give you that type of money. You can also say that, no, I cannot do it in 2 years and I need more years. There are options available up to 8 years, and you can borrow money. And of course, the company would charge you interest if you want to borrow it for that long. And that does not mean that there is a prepayment penalty, so you can finish paying it sooner than that. So I do recommend that if you need longer time, get the smallest payment possible. This way it gives you the freedom to finish payment earlier and it will never accrue the interest on the amount that you borrowed. The next question is, does all dental financing require a credit check? Well, if you're getting a payment plan from your doctor, then no, it does not require a credit check. However, if you are getting a payment plan from the bank will want to have, they call it a soft check. Basically, it doesn't show up on your credit score, it doesn't affect your credit score, but the bank wants to know what is your credit score so they can actually give you money, right? Or how much money they will give you. The next question is actually belief of most of the patients that I have encountered, and all of them pretty much believe that the insurance company will take care of everything. And it's a surprise to them that all of a sudden that, you know, not everything is covered. Basically, most insurances cover stuff on percentage. They divided everything on basic, major, and preventative. And preventative is something that you can have your examination and you can have your x-rays, sometimes maybe a polishing of your teeth, and that's it. Right? And that is covered at 100%. The rest of the procedures covered at less than 100%. It could be 80% or 50%, depending on the plan that your employer selected for you. And with that said, it's also they take the total amount of money that they give you for a year and they based it on that number. So for example, they give you $1,000 a year or $2,000 a year or $2,500 a year, depending on the plan that you have. And the amount of reimbursement will depend on that, because they don't want you to spend all the money, let's say, for your checkup only. They want to have some money for you when you need fillings, when you need crowns or root canals, God forbid, right? So for all of this stuff, they specify how much they would pay for each procedure, and they would want you to have some co-payments. The next question is, how can I find out if my dental insurance will cover the cost of my dental procedures that I need? Well, number one, we do offer a complimentary insurance check, so if you would like, you can come in here and one of my staff, depending on what you need and what insurance do you have, they can help you out and tell you exactly what would you need and how much would it cost and how much of it your insurance would help you with. The next question is, if my dental insurance will only partially cover the cost of my dental treatment, can I borrow the rest of it? Can I finance the rest of it? And the answer is yes, you can. You can finance the rest of it with different options that we have and cover the cost and get the work that you need done. And the next question is, can Steinway Family Dental Center help me to get the help that I need to finance the treatment that I will require? And the answer is absolutely yes. Like I said before, we have people that will check, we have staff members that will check your insurance and will help you to know how much you can count on your insurance to help with your dental procedures that you need and how much would be your responsibility. They will also give you a different offers from different companies and how to pay for that. And whatever option you're comfortable with, you can use that. So that's all the questions we have on this subject. However, if you have specific questions about your particular case, you can call my staff here at Steinway Family Dental Center at 718-728-3314, or just request to have an appointment online on alldentalneeds.com, and somebody will get back to you and we will answer your questions.